Hello, my name is Juan Carlos Estrella, and this is my presentation on artificial blood vessels, a case study considering cost and biocompatibility of polyethylene terephthalate, expanded polytetrafluoroethylene, and polyurethane. Before discussing the main content of this presentation, it is important to do a quick overview on the history of artificial blood vessels. In the year 1900, the first artificial blood vessel was created by German-Austrian surgeon Dr. Preyer from a thin tube of absorbable magnesium. This design was severely flawed as the patient came down with pneumonia and died 3 days later. It was not until the 1950s, which are considered by some as the renaissance of artificial blood vessels, following the successful operation of Blakemore and Voorhees, whom surgically implanted artificial blood vessels made of synthetic material. These blood vessels did not cause complications like the ones taken from cadavers. As a result, synthetic materials have been widely researched and used for constructing artificial blood vessels. The three biocompatible materials are polyethylene terephthalate, expanded polytetrafluoroethylene, and polyurethane. PET has hardness and stiffness and dimensional stability. ePTFE has high strength to weight ratio, flexibility, and fluid impermeability. Polyurethane, PUR, can realize endothelial tissue, which is the tissue on the inner wall, in a shorter amount of time than other materials. It has a relatively high Young's modulus. The table below shows the material properties, Young's modulus, Poisson's ratio, and density, not to mention the cost of each material in the current market. The materials property for blood vessels were added for the sake of reference. Essentially, this case study is trying to determine which material is right for constructing an artificial blood vessel. To determine this, all three materials were modeled after an adult male main pulmonary artery. 3 models of lengths 1 mm, 10 mm, and 100 mm were created for each material. This means 9 models were created in total. All 9 models had an inner diameter of 29 mm and a wall thickness of 2 mm. They were all subjected to a static pressure of 100 mm of mercury, or 13.3 kilopascals. Each model was simulated using a normal blood flow rate of 5 liters per minute. Then the same models were simulated using an accelerated blood flow rate that was 5 times the normal rate as a worst case scenario. It was important to examine the shear stress experienced on the inside wall of each model. This is due to the fact that blood flows tangentially to the surface of the inner wall, causing shear stress in the blood vessel. Shear stress will not change the length of the blood vessel, but too much shear stress will change the shape of the blood vessel due to shear deformation, and that is something you do not want to happen. These are the results of the shear stress under normal flow conditions for each of the materials. According to one preliminary source, the shear stress inside the inner wall of a regular blood vessel is 1 to 5 pascals. Shear stress higher than 7 pascals in blood vessels leads to internal scarring of the inner wall. All of the simulations show that the shear stress inside each of the models for the 1 mm, 10 mm, and 100 mm were under 7 and within the range of 1 to 5 pascals. Under normal flow conditions, the models will not deform as a result of shear stress. The shear stress found in the accelerated flow conditions had mixed results. The 1 millimeter model for all of the materials was close to 20 pascals, which is dangerously high. However, in the 10 millimeter and 100 millimeter models, they were relatively within the range that is acceptable. That means only the 1 millimeter is not to be used under these dangerous conditions. This project also analyzes the cost of the material given the current market. The ePTFE is the most expensive out of all the materials that were used, and because artificial blood vessels are mass produced given the current healthcare demands, this graph shows what the cost of material would be per 10,000 units given the models that were used. PET, or the Dacron as it has been commercialized in the US, is the cheapest option, and the PUR material is the intermediate. The final recommendation for this case study, the materials that was chosen was the PET Dacron polymer. These are the SolidWorks drawings, the 1 millimeter to the left, 10 millimeter in the middle, and 100 millimeter on the right. Further recommendation and further work on this would be to model how plaque sticks to the inner wall and how it affects the model overall.